Just do it, man. And then look at all the information they have on the rounds of, look at towns you know, cities you're probably from. You're from Iran, look up what they say about any city in Iran that you think is less known. You're from China, look up any city from China. Look up your town, your native town, whatever you're from, and see if the information kind of checks out. So it's a great tool for people that are interested in traveling. Now, the other thing now, remote code. So Nomad List is more like a travel guide for you. So if you have a place that allows, let me say that again, you already have the job, you're not looking for the job, but you want to know, what do I do as a traveler, as a nomad, digital nomad? Then you go to Nomad List. If you don't have the job yet, then you go to remote.co. And you check out what they have. Do you want to work clinical? Do you want to work non-clinical? And you build that practice for yourself. And then you have telehealth jobs. You can also look up to see what they have. Remote Co has a lot of jobs. It's like for anybody looking for a remote job. So not necessarily healthcare related. But in your case, being a healthcare professional, if you're board certified, if you finish residency, you go there. You could start looking there in your free time, in your third year or the second year. And then you have pretty much have an idea what you're going to be doing afterwards when you finish residency. You get your board certification, bro, you're going to be fine, man. Any specialty, you're going to be fine. Telehealth jobs, medical specific opportunities. Okay. So top telehealth employers. So who can, oh, there's information missing here. So I mentioned in there, oh man, give me a moment. Let me see if I can review that without having to stop the video. Problem with the configuration here. If you guys give me just a moment, get that information for you. This is so complex. All right. Here we go. Teladoc, Amwell, AMWELL, MD Live, Babylon Health, Doctor on Demand, and PlushCare. These are companies that are more like US based, except Teladoc, which is very Canadian. I work with Teladoc. I worked with Teladoc in Florida. I worked with Teladoc in Canada, in Quebec. I worked internationally also with Teladoc. I would definitely advise you guys reach out to these people. Very physician friendly, very concerned with their community, and most importantly, an understanding. Everybody there that you will communicate with is working telemed. So there's like 20 physicians in your group that you're going to be with likely, and you each get like a schedule. Like I work Saturdays from like 6 a.m. to like 10 or whenever you work, and the salary is actually pretty good, and you get benefits on top of that. I don't know of the different plans that all these different employers offer to physicians, but this one I'm telling you because I have personally worked with them. I worked with them before they came to Canada with COVID-19. They came to Canada and they have a lot of experience. They know what telemedicine is. Unlike physicians here in Quebec, unfortunately, when telemedicine arrived, everybody started from zero up until this day. Now, 5 years of telemedicine. Now, physicians certainly do have a lot of experience, but they don't have any formal training in telemedicine. And patients do not have proper triage in Quebec. So the physician doing the actual appointment is the actual triage person. There are no ways in Quebec right now for the government to triage a patient when they're making an appointment. I'm making an appointment because I feel like I have crushing chest pain. Okay, we found you an appointment in 2 weeks. Okay, thank you for the appointment. Literally, this will happen. This is a huge problem because there is no proper, nobody is assessing this patient when they're getting a telemedicine appointment. The government was very reluctant. The College of Physicians of Quebec was extremely reluctant to allowing any form of telemedicine practice in this province. So when it was brought into, there was never sets of precautions. So I'm saying this because the people that have experience in telemedicine, they use very efficient triage methods. In the States, particularly Teladoc, when I used to work in their giving telemedicine in Florida, I saw the things they have. They have guidelines for doctors. Before the doctor even gets the consultation request, a nurse has already reviewed the problem for which the patient was consulting. And if they were not this is not a telemedicine case, they were immediately redirected to a proper acuity of care service provider. So this is what's lacking here, which is extremely important. It doesn't even make sense how this can continue without actual implementation. And it just shows that the people that prohibited the telemedicine had no education. The College of Physicians in Quebec had zero education in telemedicine. There were zero physicians up until 2020 in Quebec practicing telemedicine. Zero. There were no trainings, and all of it just arrived overnight. So they were unfortunately unprepared for COVID. COVID did bring the opportunity to do these significant and very positive changes to the healthcare situation in Quebec, but they are very slow and very reluctant to actually implement necessary changes. There's nobody supervising this evolution into practice.